Hello, my name is Dr. Sam Breeding. I want to talk a little bit about how HCC coding works, but before I do that, I'd like to tell you a little bit about myself. I'm a practicing physician. I have been in Houston Medical Group for the past 20 years. Houston Medical Group is a multi-specialty group that has just over 100 physicians and 40 mid-level providers. We're located in Kingsport, Tennessee, which is the northeast section of Tennessee. In January 2014, I was asked to become the Chief Medical Officer of the group. My first directive was to educate the physicians and practitioners about Medicare Advantage and HCC coding. Houston Medical Group had been in several Medicare Advantage programs over the last few years, initially starting at a no-risk 25% gain share, moving up to a 50% risk. But in 2014, we were at a full-risk 100% gain share program with one of our insurance company, and it was imperative that we executed to this contract. The problem I had was I knew nothing about Medicare Advantage and HCC coding. I'm board certified in both family medicine and occupational medicine, but I had spent the last 30 years practicing only occupational medicine. So you could ask me pretty much any question about workers' comp and I would know the answer. But when it came to Medicare and Medicare Advantage, I knew almost nothing. Fortunately, I had an excellent teacher. He was an administrator who had worked in both the insurance industry and healthcare administration side of things. And so he helped me learn about this. The problem we were having was getting the physicians to understand how these worked and how the programs were to come together and how to execute this. And so they wanted me to help be the person to educate them with this. We thought that we would start at our annual meeting that was held in March of 2014. The theme of the meeting was going to be the rules of the game. In this, we were going to talk about how the rules were changing from a fee-for-service medical practice to a pay-for-value medical practice. And as you know, Medicare Advantage is really a pay-for-value practice. My talk was to be an introduction to Medicare Advantage and HCC coding. And I must say the talk was well received because the providers were anxious to learn about this. They knew that we had an important contract and they wanted to know more about this. Well, after the meeting was over, I realized that I had to learn more. And the problem is there's no real single source of information when it comes to HCC coding. And I literally spent several hundred hours reading everything I could find on HCC coding. I did a lot of research and also talked to many coding experts to try to figure this out. So I started putting together some talks. Started with 30-minute talks that I went to each practice and did what I called lunch and learns, where the doctors would have lunch while I gave them a lecture on HCC coding. I also put together a series of talks that lasted 10 to 15 minutes that I called the HCC moments. I gave these talks at board meetings and section meetings, but still it was more of a hodgepodge type presentation of the information, and I wanted to put together something a little bit more cohesive. So I spent more time merging some of these lectures together, and I put together a comprehensive education program for providers. And this has turned into the video program called HCC Coding for Medical Advisors. Medical Providers. This is very important for our doctors to learn to do because HCC coding is going to be the lifeblood of the Medicare Advantage programs. But we've also seen that HCC coding is moving now to the major way to risk adjust programs. It's moving not only through Medicare Advantage, we actually have a commercial plan that is using HCC coding to compare how group costs compare from group to group. Also, as you may know, HCC coding is going to be used as the primary risk adjusting method for the Affordable Care Act. And so HCC coding is not going away, and the more you know about it, the better off you're going to be. I put together a series of presentations that turned into a video series that we now use to help educate our doctors. It's been very successful along with our other efforts. We have increased our risk scores by 20% in the past year on our patients. HCC stands for Hierarchical Condition Category. This is a system of risk adjustment used by Medicare Advantage. In this video series, I will talk about the history of risk adjustment. I will also talk about Medicare Advantage and how it differs from regular Medicare. I will also look at how Medicare Advantage gets its funding. As you know, it is a combination of demographics and health status of the patients, and of course it uses the risk adjustment model of HCCs. In this program, I'm using ICD-10 coding because that is what we are all using now. I will look at the characteristics of the CMS HCC model, including the fact that it is prospective in nature. We will also be looking at the different sources for diagnostics and which ones count and which ones don't count. We'll look at how HCCs correlate with multiple chronic diseases and also disease interactions, and of course the demographics involved with this. I will take a few minutes to look at the star rating system. Medicare Advantage programs that score well get bonuses, and this is very important in funding of the plan. We will also talk about the importance of documenting the diagnosis in your patients on a yearly basis. I will take a look at the acceptable facilities and acceptable providers in supplying information to Medicare Advantage programs. I will look at acceptable document sources. For example, intervention and therapeutic imaging reports are acceptable. However, diagnostic radiology reports are not, because the diagnostic radiologist does not have a face-to-face encounter with the patient as a general rule. Also, again, we will cover this very, very closely because it's very important that you have to have evidence of a face-to-face encounter with patients. Because this is the ICD-10 edition, I will do a little primer so that doctors will understand a little bit more about ICD-10 and how that works. I will look at why HCC codes are important and explain the financial parts of HCC scoring and how it affects the funding of the Medicare Advantage program. Importantly, I will take a look at patients. There are 25 different patients in this video series, and I will show how if you have what I call coding dysfunction, your Medicare Advantage program will miss out on thousands and thousands of dollars used to take care of the patients in the program. For example, in this particular patient, with poor coding, there was only $464 per month to take care of the patient, but with proper coding, there was $2,035, a difference of $1,500 a month in funding to take care of these very sick patients. I will explain how Medicare Advantage gets funded and show how this all works out with the pay-for-value pool and how Medicare Advantage, some will charge premium, some will not, and how all that affects the amount of money that we have to take care of these patients. As you know, there are many added ICD-10 codes that map to now 79 HCCs. we will take a look at all these categories, and I will present each of these in a chapter, and we will look at a patient who has all these conditions and review the diagnosis that are HCCs in these particular HCC categories. And finally, I will take a look at the most common coding dysfunctions in HCC, because these are very important in maximizing the amount of reimbursement that you get in the Medicare Advantage plan. I think you will find this will be a very educational program for all the providers in your system. If you're an individual, I think it will help you tremendously in understanding how this works. I would like to encourage you to consider this program. After all, you only have to code one patient correctly to pay for the cost of this program.